Hey guys, Dr. Brotsky here. It's week 29 of your pregnancy. If you haven't checked out the other videos, take some time to do that. At this point in pregnancy, the baby is getting fatter and fatter every single week. So lots of fat accumulation on your baby, which is super exciting in preparation for delivery. The baby on average weighs about 3+ pounds at this point. So if you can imagine that, then that's a pretty big baby you're carrying around. What to expect right now is some tightening or some pressure in your belly, especially when you're too active. If you overdo it, you may notice that your belly just gets tight sometimes. So take a break, rest and relax, but if it's painful, then definitely call your doctor or go to the hospital. You're also going to notice that your extremities are getting more and more swollen. So your ankles and your legs, especially if you sit for a long time at work or you stand for a long period, you're going to notice that those get very swollen. So elevate those feet as high as you can get them, drink lots of water, and that'll totally help. From a doctor's perspective at 29 weeks, this is when I routinely discuss the Tdap vaccine with my patients. I mentioned that at the last visit. It's got tetanus, diphtheria, and then the pertussis coverage in it too. And it's safe in pregnancy. It's routinely recommended at 29+ weeks in every single pregnancy for you. One of the reasons is because it allows the antibodies to build up in your system, cross the placenta, and some get to the baby, and the baby's born with some antibodies to protect them. In addition to that, it also protects the infant at home with a vaccinated parent to make sure that they're in this vaccinated cocoon of adults around them when they're born. That's highly important because we're seeing a resurgence in whooping cough, and that can be deadly to a newborn, so it's worth talking about. If you have questions or concerns, definitely talk to your doctor about it, but anyone in close contact with the baby is recommended to get this. You also want to think about making sure your classes have been scheduled or that you've done them already around this time, because you're running out of time and sometimes schedules can be tight. So make sure you finalize all those decisions about prenatal classes. And then pre-register at the hospital, make sure you're in the system. Things you can be doing right now are counting fetal movements, looking out for preterm labor. At the doctor's office, you can ask your doctor for a breast pump prescription. Call your insurance because they are required to provide those with maternity care now. So call your insurance company to see how they want you to arrange that and get the prescription from your doctor. That's it for week 29. Thank you so much for tuning into my channel. Check out my other videos as well, and you can find me on drbrotsky.com.